some training in place to support evaluation going forward, in particular with the logic models. We also do have some accompanying guidance, as you probably have seen in the template that's been circulated, that hopefully will help as well. But today is about bolstering that and getting you to think about things in a workshop sort of setting that might help the development of your logic model a little further. We're also thinking of doing a drop-in session after this in the coming weeks. So if once you've started getting your logic model underway, or you've been further developing it, we'll have the opportunity to have a bit more of a one-to-one or a small group session. If you want to come and pick our brains about something in particular, struggling on this section, can't think of what to include, what measures could we use for this, and that kind of stuff. The almost unanimous feedback that we had last year when we introduced these, we made quite a few changes last year, but with the logic models, the feedback that we had was that teams were really grateful that we'd had an opportunity to do these, because it actually really challenged the thinking and the plans around evaluations. They found it a really valuable experience. So I hope you find the same as you move through this process. It shouldn't be a huge undertaking, but hopefully a really valuable addition to the piece of work that you're delivering. For us, it helps get a greater understanding of the plans that you're doing post-bid, see if there's any areas we can help add value or check for alignments and link you up once the work is now underway. And then ultimately it supports us gauging return on investment. So we ask you to do a logic model review at the mid and end year reports as well. So it's actually a really key document for us. Just to run through perhaps the first housekeeping slide, if you don't mind, Silvie, before I introduce you. Just wait for the slides to pop up. Thank you. So just the usual fare, but just as a reminder, do keep your mic on mute during the session, just to avoid feedback, but we'd encourage you to leave your cameras on if you're happy to. It's nice to see your faces and see your responses to things, but if you do need a break from your screen, happy to turn it off as well. There will be the chat function available. If you've got any queries, you can pop them in there, or indeed raise your hand if you want to speak, ask a question, contribute in any way. You can also do that too. The session is being recorded, as you'll have seen today, and the main reason for that is there's a whole bunch of programme and project teams that couldn't join us today because it clashed with other activities. So we're going to share it with them, and if it proves to be a really valuable resource, we might roll it out on an ongoing basis as well. So hopefully it'll be a long-standing resource that we can draw on. Finally, let me hand over now to our partner organisation. So we've partnered with the Applied Research Collaboration, which is actually where I'm seconded from. There's a number of them around the country. I'm from the Greater Manchester one, but Silvie is from the North Thames one, and that she's going to deliver the session today. We hope you enjoy it, as well as getting a lot from it, hopefully, in terms of supporting your development of your logic model. And hopefully you'll enjoy an hour of no emails and time to focus on your learning and how to get the best out of your piece of work. So with that, I'm going to introduce Dr. Silvie Cooper, who's a lecturer at the University College London. And like I said, she works with ARC North Thames, and they deliver a range of training, including evaluation and how to get involved in research. And over to you, Silvie.
Thanks so much, Sue, and thank you very much for the invitation, and to all of you for joining today's session. Just to say, as Sue said, I am part of ARC North Thames, based at University College London. I teach on evaluation as part of this work, so the teaching that you're receiving today is drawn from a course that we run called Introduction to Evaluation, which covers logic models, but also how to kind of plan and design an evaluation that you have in mind, different methods you would think about using, and it's available online free of charge, and will run again next year. So just to flag that and say it's a resource I'll highlight at the end, but it's just to say it fits in with that. I'm really excited to be here with you today. Having read through the range of projects, it's a very diverse and dynamic group of people, and so I hope that you'll also take the encouragement to learn from each other in this session, but through the support that's also offered by Sue and colleagues across the piece. So I'm going to just give you an overview of the objectives for today, and then we'll move into how today's session will run. So hopefully by the end of today's session, you'll be able to create an additional logic model for your own intervention, which you can use in your evaluation. You should also be able to recognize the opportunities and the limitations of logic models for evaluation, and begin to identify some strategies for developing and adapting logic models. The reason I say this is that logic models is one of many approaches that you can take, and I try to not be prescriptive in the way that logic models are applied. So there are lots of components to it which you may be familiar with, but we'll also cover today. And it's really about making it suitable and fit for purpose for your setting, for your intervention, for your project. So I think we are pretty much on time with the joining, welcome and introductions. I'm going to give you a short 20-minute presentation on what, why and how, the kind of components of logic models and why we use them. We will then do a whole group of activity where we identify logic model components for a case study. And then we'll have a discussion about the benefits, challenges, and opportunities of using logic models. We've also allowed about 20 minutes towards the end, but can be a bit longer, to do some troubleshooting and get some feedback on your logic models and evaluation plans from myself and Sue, but from the team about that. So please do make use of the chat throughout if there's anything that you would like to kind of flag and query. I'm also very open to you pausing me, so raising your hand and saying something isn't clear or you'd like a bit more detail on it while I'm talking. What's really lovely about this kind of session is learning together, and so I'm very open to having you be part of the conversation that we're having and to contribute to that as we go along. So I have also put in the chat the link to the Mentee. Now there is the code there too. So if you go into the chat, it should take you to the link, and there should be an opportunity to input a response to a question. So what I'd like you to do, just as a first exercise, is to note the key stakeholders of your evaluation project. What you can do after this is to think about the relationship of these stakeholders to your project. So are they primary stakeholders, secondary stakeholders, stakeholders you didn't think of initially but could have a role, or are stakeholders not relevant? And so by the magic of the internet, I hope, we will start seeing some of your responses appear here. While you are thinking about this and completing this activity, the reason that we bring stakeholders into this discussion is because we do evaluation for several reasons. One, it's to monitor and track what we set out to do and whether we achieved that. We also do evaluation to provide some basis of evidence and or value or benefit to what we've done and who might stand to benefit further. And we want to share our practice as well in the process. And so all of those different functions of an evaluation relate to different groups of people and different audiences. And so having who might be interested or benefit from your evaluation in mind when you go into designing it can help you structure what you do to maximize what you want to share, how you want to share it with them. And so I'm really glad that you are taking part in this and that you can see a whole range of people who may be the beneficiaries or the stakeholders or the people who are who are invested financially or otherwise in the work that you're doing. So we've got providers, the Workforce Collaborative, different types of health and care professionals, people on the ground, commissioners, senior management teams, patients themselves, employers, and let me just let it stop jumping around. And I think also actually interestingly, somebody's noted, or a couple of people have noted, internal and external stakeholders as well. So those that are either in your team or in your organization, and those who are outside of it. And so on my previous slide, when I was talking about primary or secondary stakeholders, perhaps as an activity to take away, think about what level the stakeholders you've mentioned fall within. Are they going to be the primary people to either benefit from or use your evaluation findings, or the service that you are that you're planning to evaluate, or are they slightly more periphery to that? And great to hear that Rachel has spent today doing stakeholder mapping, so is presumably very acutely aware of who is included in this. Great, thank you so much for taking part in this. So I'm going to leave this up here, and you can also get the results afterwards. So if I then move into what logic models are, why we use them, and how do you go about building one. If we talk first about the what, there are different approaches that are taken to linking interventions to the outcomes. The two that I'm going to discuss today are logic models and theory of change, but there are other approaches, and they kind of use a similar structure, such as driver diagrams, social network analyses, system maps, and models. And what I would say here about the key difference, or the key similarity between all these approaches, and the key difference, is that all of them take, to greater or lesser extents, a structured approach of saying, what is it that you're trying to do? Where do you see a change happening? And what would the outcome be? And then these different types of approaches go to greater or broader detail about those components. So you'd look at a logic model at the specific intervention and the things immediately around it, whereas perhaps with the system map, you're taking kind of several steps back and trying to look at how something works as a process. So to just keep that in mind. To show kind of in a picture form, the kind of key differences, and as I said, the different levels that we look at of logic models versus another approach called theories of change, is that in a theory of change, you will get the strategic level, so you'll get the big picture. It's not that it's thin on detail, there can be a lot of detail with that, but you're just looking at it from a different perspective. Whereas in a logic model, or in a logical framework, which is also what it's called, what you're doing is zooming in and looking at the kind of closer program level. There are lots of different ways to display both theories of change and logic models, and I think the template that's been provided to you is really suitable and useful and practical, and so I would recommend drawing on that when you are doing your logic models. So you could have in a theory of change that it's more kind of visually appealing, that it tells a narrative or a story. And what that does is help you kind of capture some really complex processes. It's quite difficult to describe to someone how they see a change happening in words, but you could draw it out and kind of see in that mapped view where different things fit in, where they follow through. A logic model is often quite popular because it's actually visually very neat. It has set components, you put them in, you show the pathways, and usually it's kind of unidirectional. So it goes from your inputs to your activities, to your outputs, to your outcomes and your impact, and it all goes in one direction. That's very rarely the case in practice, and so it's also important to remember that. Lots of things can be happening simultaneously. Sometimes you have progress with one output, and in fact, the impact comes much later. And so to just understand that too, they are an imperfect tool. It's a template, and it should be made fit for purpose for you. So now moving on to what logic models can generally capture. And I've noticed that there's some information going in the chat. I will come to it in a moment, but please do flag if you want to ask anything about what's on the slides presently. So logic models can generally capture inputs, activities, outputs, outcomes, and impacts. But they can also prompt you to think about what is the rationale for the change that is proposed. So what is the kind of impact or benefit or thing that's going to happen while you're doing this. It can also help you think very usefully about the context that this change or this intervention or this program is happening in, as well as identify barriers upfront from the start and any kind of key assumptions that you're making when you are going into the delivery of this program or intervention. So why would we want to do a logic model? Well, I think going back to the previous slides on kind of the different approaches and why they're useful, in a lot of ways, it can help you clarify and document what is the underlying logic, what's the theory behind how an intervention works, what is the change you want to see. And it helps us make some implicit assumptions about how we think this happens, more visually, narratively, and theoretically explicit. So it brings the stuff to the surface, helps us draw out why do we think it's working the way that it does. It can act as a living guidance to support sound implementation, evaluation efforts, and an ongoing critical reflection of your performance. So it's a way of sort of holding you a bit accountable for the way that you're approaching something or how you think it works, and then measuring against that. And because you do, if you could ideally do it at the start, it acts as your baseline. So it gives you a point of reflection to then think, well, where does this go? It's also a living document. So it isn't that you do a logic model once and then that's it. It's something to come back to update, to refine. And I think, as Sue was saying, as part of your process, you're encouraged to take these different points in time and think, well, is this still fit for purpose? Are there things that have changed? Are there assumptions that need updating? Are we seeing the impact as readily as we thought? So to make it kind of something that is iterative and that is a general summary, but also something that you interact with. I think I've said it a few times, but I will say it again because it's worthwhile. A logic model approach has some limitations and you should be prepared to adapt for your own purposes. So it is not perfect. It's not prescriptive. Please make it useful for you. There's also some questions, and I think they're fair, about the fact that a logic model takes a lot of time and a lot of effort to put together. And so would you really need a logic model when something is in process, when a program's been delivered, when you are already adapting or refining an intervention that already exists, or there's an existing evidence base? It's also, is it useful if I already know what I want to do? I don't need to figure that out. And so why should I spend extra effort on doing this? There could also be questions about if a program has finished, why should you do it? In all cases, I think that there's both a practical and a practice point to this. So on a practical level, it is a good investment of time to plan appropriately, to use a structured approach, to try and understand and be able to also then relate to others what you are trying to do. And the logic model gives you a very good template for having those discussions, for demonstrating what you're trying to do, and then sharing it readily with other people. It's good also if you know what you want to do. And in fact, then a logic model becomes an opportunity to sense check what you want to do. And so you've got, again, some point of accountability or a point of reflection to move forward. You can use logic models retrospectively. So if the intervention is complete and you're thinking about how do I evaluate this, it helps you draw out a narrative of why you thought it would work the way that it did. And if it didn't work the way you thought it would, what you might do in response to that. So where you might change activities, where you might look for different outcomes. But it's that point about, taking a structured approach to what you're doing. So in summary for this, logic models are one of many approaches that help you think through and represent the key elements of your intervention, your program, or your project. There are lots of different ways to form and represent them, but what they should do is help you articulate the need that you've identified, what you do or what you did, and how you expect it to make a difference. So I'm going to, before I go into the how, pause here and ask if there are any questions about the what and the why. Is there anything that you'd like clarified at this juncture? No? I can see shaking heads, but I don't know if the ones that I can't see, if there's any queries about it. Sue, is there anything from the chat that I should respond to at the moment?
Not at this time.
Okay, great. Well, then let's get straight stuck into the how. How do we do this? So using the template that you have already got on logic models, you should see that there are different elements to fill in. And some of them are very easy. So, you know, who completed this and what date and what version is it? That should be, I think, fairly straightforward. But then in the context, the rationale for change and the assumptions, that again, that should kind of have some thought, but be pretty set across the piece. And then you've got inputs, activities, outputs, outcomes, and impacts. And here we've got little images of post-it notes. And the reason for that is that it's actually very useful to use it with a flexible, iterative approach and say, well, something that I thought was an input could be an input, but it might also be an activity. And so should I kind of move them around? Should I try and see where it fits most neatly? Am I articulating this well? So use it as a flexible tool in the first instance when you're using it. And what I'm going to show you now is an example of a completed logic model for an intervention. So this is the Couch to 5K physical activity app. I hope some of you are aware of it, but the kind of basic elements of the app are that it's a physical activity tracker. It encourages people to gradually build up from walking to running. And the result is that you would run a 5K in kind of 30 to 50 minutes, but it's the kind of progressive exercise program, and it has a whole lot of different elements to it. But the context is the reason that people want to kind of introduce this app is because many adults spend more than 7 hours a day sitting or lying. And particularly during lockdowns or in, you know, recent changes to our usual habits, more people might be less active than they were. And we know that there is a risk of ill health from inactivity. So the rationale for change is that the Couch to 5K app could help users be more active and lose weight. We have an assumption that people want to improve their health and they're willing to invest time in this instance in getting fitter. So some of the activities around what we do to embed this app are that we promote it on different media platforms. We also have some media embedded in the app. So in the current version, we have some celebrities as the kind of coaches who you know, encourage people to do this. We have analytics tracking, so we see not just that people have opened the app and accessed it, but we see how far they get in the app. We see how many sessions they complete and what timeframes. We also use search engine optimization so that in the app stores, it becomes the first app you receive a notification for when you search for an activity tracker. And we also employ ongoing user testing to kind of refine it and tailor it and make it more usable for the people we want to use it. And so our outputs are that we know that paid for apps do have higher engagement, but cost is a real barrier. And so we make it a free running app with a running plan, some professional tips, this progressive build up to running a 5K, and we also embed an online community support group. So I will also say the Couch to 5K app is a very heavily invested, like very expensive, well-established intervention. So to also scale some of these outputs and activities in that context. And so when we think about the inputs and then the outcomes and the impacts of this, looking at the inputs on the far left, you would need expertise and time and budget to keep this app running. There would be very little point in the app if you put in all this evidence, you put in all these fancy bells and whistles, and after 2 years, it stopped being used. It'd be a big, return on investment loss, I'd say. You also actually do need research and existing evidence to validate the approach you're taking. If you were to just say, we thought the app would be fun, or we thought that people definitely liked apps, but you had no evidence to back that up, it's very unlikely that it would be taken further or that it would be routinely recommended in, for instance, lifestyle activity advice in the NHS. Some of the outcomes we would want to see are that users are confident enough to run, having completed the program, and that there would be a general increase in physical activity. You'd also see improvements in fitness and reductions in BMI. And the main outcome is that people would actually complete this program and graduate from it. A longer term impact might be that we want to see prevention of illness related to a lack of physical activity and being overweight. It'd be quite hard to prove that this app itself kind of led to a population-wide reduction or a population-wide, increase in activity. But if you could track over time a cohort of people who used the app and you tracked what else they were doing, and you could say maybe in young people, if there was a barrier to them taking up exercise, that there was later an increase in physical activity, perhaps that's one way to prove that this app has had impact. Are there questions about where these different components fit in? And then I have a question to you about kind of how we might evaluate some of this. So are there questions about where the components are fitted in, or what the information is that's related to them? Sue?
Just wanted to add, while people were thinking, our experience of doing it over about the last year was that the trickiest bit for people to complete was to unpick the bits between the last 3 boxes in the middle. So what is an output? What's the thing that you're going to actually create, deliver? What are the outcome? Well, jump then to the impacts. What is it you're trying to achieve? Workforce retention, increase in well-being of the workforce, whatever those big things are. But like you said, they're often, those things are quite difficult to pinpoint to your piece of work. And then going back to the middle bit, then doing the gap in the middle. What are measurable things that that can be attributed to the things that you're creating, the benefit of the piece of work, the outputs that you've created? And so I think that for us is, for the evaluation subgroup, it was one of our points of learning, was additional clarity on those unpicking those bits.
Yeah, I think as we've also discussed, the point about measurable and measurable impact is that impact happens on a kind of much broader level, and it is slightly less tangible, but you can link it through by saying that, in this case, you had a group of runners who were previously not runners, and you could measure over time that they either continued running or that they had greater fitness. You could use the initiation of the app as the point in time from which there was a change, which if nothing else in their life had changed, that would be your impact and the link through, I'd say. But I agree that it's not easy to see the kind of, again, unidirectional, or it's solely your intervention that's made this massive impact. So I think what I'd say is, firstly, assess what level the impact is happening on, and understand that a lot of the time impact means broader context, kind of much more beyond the scope of what you're particularly trying to achieve with your intervention, but that you can explain the benefit in general terms that an increase in or an improvement in well-being of staff as a result of taking part in this program can be linked to the activities that you undertook.
Absolutely. And I guess just in case anyone's sat there thinking, well, we haven't got anything that's measurable. When I say measurable, it can also be quite qualitative as well, because I recognise a lot of the work that we do might be, scoping, it might be developmental. You might not be able to say you've changed this in terms of numbers. So I guess an outcome for this might be really positive feedback from people using the Couch to 5K app. That
completely. And even I'd say if somebody says, I found the program really great and I completed it, but I didn't continue running, that's still actually quite an important outcome to know why or why not somebody might do it. So yes, it's not just about the things that you can see or measure, it's more qualitative information. And I think what I'd say also is to link the outcomes to actionable things. So if you wanted to prove that it was beneficial and you wanted it to continue, having as part of the evaluation plan what the next steps would be for writing a business case or sharing what you found to make that change in practice happen. Angela, you had your hand up?
I did. I think you've half answered my question, but I guess given that so a lot of the stuff that we do in primary care is around retaining primary care, etc. But I don't think, bar about a couple of things, there's very few things that we could hand on heart say was all us. So I guess my question around some of those impacts is, can you attribute some things to impacts that you probably had a hand in, but you couldn't hand on heart say all of this was down to us? And then my other more practical question was, if, for example, we retained 10 GPs, would that be an outcome or an impact?
Oh, great questions. Okay, so the first one, I'd say that you would probably include something about the context. And then you'd say that this was one intervention of several at a time when, I don't know, more investment in workforce retention was going on, or greater training opportunities were available alongside ours. Ours definitely made the most difference, for sure. But right. Yes, context, but putting context with it, I think would be a good way of covering what you are trying to say. And then your other thing was about whether it would be an activity or an output. So just remind me what the scenario was.
So say we did an intervention.
Yes, you had 10
and we retained 10 GPs. Where would that sit, I guess, in that?
So to me, that would be an outcome.
An outcome, yep.
Because it's the kind of number of things that happen. So you retain at 10 GPs, but your activity would be, we provided
whatever the intervention was. Yeah.
Yeah, we provided yeah.
So, but then what would the output be? Sorry, I guess this is just so I can get this order in my head. So say we developed a retention program for GPs. In my mind, that's the activity, or is that the output? And then as a result of that retention program, we retained 10 GPs. I guess I'm just trying to logically order it in my mind.
So I would say that the designing of the program, the different things that go into creating the output are the activities.
Right. Okay.
And the output is the program itself.
Yeah.
It might be a toolkit or a document or a website or whatever it is, the thing that you're creating that leverages the change.
Yeah. Exactly. And then the outcome would be that as a result of taking part in this retention program, 10 GPs were retained.
But the key bit would be that it could be attributable to the stuff that you've done. So you'd have to have to be able to track it. Otherwise, it becomes an impact effectively if you can't say that's down to this.
Okay, and then a potential impact at the end of that. Say those 10 GPs, I'm making this up now, were retained in the same area. And then the next time there was a patient survey, that survey had really good results, and a lot of the commentary was around how great the access to GPs was. Could that be included in some of your impact?
Yes, if you
completely made up scenario.
Yeah. So you say, we want to, in a year's time, assess in the patient satisfaction surveys that they had greater access to GPs, and we'll compare the patient satisfaction surveys from the year before with this, and the main change has been the retention of the 10 GPs.
Real, thank you.
Great. Rachel?
Thank you. No, I think you've probably just covered it off for me then. It was just really in terms of if you were trying to roll it up into sort of different types of terminology, basically your inputs, your requirements, your activities are the stuff that you're pulling through from your project plans. Your outputs and your outcomes are your deliverables, and your impacts is essentially your overarching vision.
Yeah, I think that's a really helpful way to think about it. Yes, I think that's very practical.
Thank you.
Great. Other questions or comments? Okay, great. So now we're going to do an exercise together. This one is going to look at the logic model components for the Making Every Contact Count intervention. So we're going to identify just some queries around activities, output, short-term outcomes for this intervention's logic model. So to tell you a bit about the intervention before we go into it. So this is in the context that health behaviors affect risks of long-term disease, and health and healthcare staff and care staff have millions of conversations with members of the public every day. So it feels like a real opportunity that if you could embed some information related to lifestyle in these conversations, it would kind of have very broad reaching impact in the first instance, but it's kind of taking an existing opportunity and utilizing it slightly differently. So the rationale for change is that we should train staff to deliver healthy lifestyle information, particularly around quitting smoking, diet, physical activity, that could positively impact people's behavior. Our assumptions with this are that staff are willing to take part in this training, that they do definitely have contact with members of the public. And I think, you know, there'd be a question raised here about maybe the impact of virtual consultations or reduced contacts in this recent period, where that sort of opportunistic, let's have, you know, a little bit of a chat about your health generally, or, you know, the ability to kind of do other types of work around a consultation or a contact might have changed. So it's just to say in this context. We also assume that staff are willing to have these conversations with people, and we also assume that the conversations do actually affect behavior. I would argue that there's possibly a really big assumption in that the kind of, you know, position of healthcare staff and what they say and then what people do, as opposed to other things like structural factors of, you know, income and circumstance, have more of an effect, but that's a debate for another day. Anyway, our assumption in this logic model is that all these things hold, and so this is how it should work. So our inputs are that we have provided financial resource, i.e. backfill for staff to attend training. We've identified our staff group that's going to be trained, and importantly, we have organizational leaders buy-in. So they are supportive and they want people to have this. Our outcomes are going to be the number of healthy conversations that have taken place, that there'll be an increase in the staff who have been trained, their own healthy behaviors. So they may start thinking about, you know, changes to their lifestyle as a result of participating in this training. We also want to monitor for the number of staff who take up lifestyle services, and perhaps we want to also monitor whether there's an impact on staff sickness. So an assumption that wasn't written there was that we think that, in fact, participating in this training will also impact the staff's behaviors in this. And then on a broader kind of more, on a broader level, in our impacts, we're going to see the number of users who report changing their behavior or taking steps to improve their health. And perhaps we do something like looking at rates of decreasing risky lifestyles or unhealthy behaviors. So we see that in a service there are fewer smokers over a period of time, for instance. So what we're going to do now is go to the Menti again, and we're going to select a category for which items belong in which category. So wait, let me not give you the answer. There we go. We'll go back to it in the end. So can you tell me whether number of staff trained, trainee satisfaction, knowledge and confidence are examples of activities, outputs, or both? I shouldn't show you the results because now everybody's going to switch it to that. It's okay though. It's not a marked quiz, really. Okay, majority of you have said outputs. Oh no, wait. Yep, okay, but some have said both. Okay. I'm going to leave that there for a minute and then come back to it. So now the next question is, which of the following ones are examples of short-term outcomes? So that's increase in trained staff's lifestyle knowledge, increase in trained staff own health behaviors, and the number of staff who take up lifestyle services. So see if you remember what we talked about. Okay, so we have 8 people saying number of staff who take up lifestyle services, and 5 people so far saying increase in staff's lifestyle knowledge. Okay. And so now if I go forward or backwards, let's see what happens. Yeah, okay. So if I go backwards, you'll see that increases in staff's lifestyle, trained staff lifestyle knowledge is in the outcomes. Whereas, which I think a few of you identified, whereas trainee satisfaction, knowledge and confidence sits in outputs. So Rachel, you've got a question about this.
Yeah, sorry, I'm just a bit confused between like qualitative and quantitative, because all of those things could be measured.
Yeah.
So each of those things could, and I appreciate you've got the actual description in those boxes, but you could make each of those criteria, if you like, quantitative.
Yeah, you could, and that would be okay.
That's where I'm just struggling between. To me, they just all fit into deliverables.
Okay. Okay. Yep. I hear what you're saying. So, I think we probably need to clarify what you mean by deliverables. So, because to me, deliverables can be both the kind of physical thing that you produce, the activity you undertake, and the kind of outcome or the thing that results from your intervention.
Yeah, so I think when I use the word, so if I'm talking about activities, I'm talking about things that need to take place as part of the project plan, if you like, so actual tasks that need to be performed. And when I'm talking about deliverables, I'm talking about both outputs and outcomes, as you would term them, some of which may be more qualitative in nature, but as many as you can possibly would be as quantitative as you can make them.
Sure. So I think that in this example, certainly number of staff trained could be an outcome. But in fact, you know, to see the change as a result of it, not just what happened, but what the change was, the increase in the knowledge of the staff would be an outcome because it would be the result of it. So
yeah, I guess where I'm struggling is how do you ask, so to ascertain that outcome, what's the question that you're asking?
So you'd probably do a pre and post survey, and you'd say, what was your level of knowledge before you did this training about lifestyle behaviors?
Mhm.
And then having attended the training, what is your
Yeah.
current knowledge on this? And you'd hope to see that they went from, in a Likert scale, a rating of 3 to a rating of
Yeah.
5.
Exactly. Okay. Versus the question of
How many people attended?
what did you feel you gained from this?
Yes, exactly. What did you feel you gained would be a much more qualitative one. They could still, you know, have a rating in that. It could be I gained confidence, I gained, you know.
Well, that's where I'm struggling with. We've got number of staff trained.
So it would just be that I trained 20 staff. That would be my output. This is the number of people who received the package of training. And then in an outcome, it would be staff's knowledge increased by this amount.
Staff reported an increase.
Yeah, staff reported an increase of this amount. An average rating was this amount.
I suppose for me, if it helps, I think of it in a simplistic way. Is outputs is what did you do, and outcomes is what changed as a result of that, what you did.
Right, that
Yes.
helps a lot.
That's much more helpful. Thank you, Sue. Yes. Okay, so having thoroughly confused everyone, are there other aspects or elements of this that you'd like to go over? I would also say that I've sort of deliberately led you down a muddy path, because part of getting you to discuss how to use this is to kind of become very practical and go out through the nitty-gritty of what is in fact an output, an outcome, and an impact. Pete? Or is it Kay?
You go ahead.
Yeah, it's Kate. Oh, sorry, I thought you were
Sorry.
asking. Could you just explain, so in the outputs, the second bullet point on the outcomes, training, satisfaction, knowledge and confidence, what output do you mean by that? What do you mean, that a survey was given out? Or?
Yes. So I also see why it's confusing, because it's in 2 places.
Yeah,
So,
that's
yes. So that you'd want to know as an output that generally you're looking at, you know, you're going, yes, exactly. It'd be the survey that like looks at how satisfied, what knowledge and what confidence trainees have gained or feel in relation to this.
Yes, I guess it's, yeah, kind of using that measurement tool would be the output, and then the
Yes.
outcome would be the results that came through the measuring tool.
Yes.
Yeah. Okay. Thanks.
Good. Thank you. Okay. So, I think it's Louise.
Yeah, hi, sorry, just a really quick question. When it comes to the inputs, it says this always includes money. Do I need to sort of specify where the funding pots are coming from, or be really specific, or just say that we've got a financial input?
It doesn't always, Sue, does it always have to say financial inputs? So just check with the logic model that you've got, Sue.
So you can include it if it's, you don't have to go into great detail, but if you think it's important, then I'd put it in. Obviously we're funding you, so we know we've given you money, but if this logic model depends where you're going to use it. If you're going to use it elsewhere, it might be helpful to include a level of detail, especially if you've had funding from more than one funding source, for example. But we're not necessarily looking for less is more from my perspective. So you can just simply say funding if that's something that's relevant to this piece of work.
Great.
Yeah, and I mean, if you've got, you know, some in-kind time from someone, that could also be valid. It doesn't have to be the kind of specifics of the finances. Okay, brilliant. So then, thanks very much for taking part in that. So now we're going to kind of have a discussion about some of the benefits of using a logic model, and what you would use it for in planning your evaluation, and some of the challenges faced, which I think you know, it wasn't focused on your evaluation, but I think we have actually covered some of the challenges of using this model in figuring out which component it is, and to kind of get some feedback from others about your evaluation plan. So if you could, in the chat, just say what your evaluation or your project looks at, because I think you've said where you come from, but now if you could just say kind of generally what your project looks at in terms of its evaluation. So like things that you'll be evaluating. And I'll give you a second for that. While you're getting on with it, can anybody who's willing to raise their hand and kind of say what they might have identified in this process as a benefit of using a logic model? Angela and then Sue.
Yes, it provides I mean, the clue's in the title, doesn't it? But it provides a logical step-by-step approach. I think sometimes it's really easy to kind of jump into the middle and start doing stuff and start with action, rather than thinking about the steps along the way. And this kind of orders your thoughts and makes you really think about what you're trying to deliver and what you're trying to achieve and why. So it's quite useful in that context.
Brilliant, thank you. Sue?
I was just going to add, while people are thinking and typing, the feedback we had last year was one of the key benefits was the bit in the middle, again, the outcomes bit. A lot of people kept saying, we're going to improve retention, we're going to improve well-being, we're going to do bring new people into the health and care service. But they hadn't thought about actually how they're going to demonstrate that they've actually had an effect. So it was working out what the bit in the middle was. What are they going to measure or demonstrate or convey that they can say, we've done this, this is the benefit that we've brought. And I think it's got lots of teams thinking about how they were going to measure those things as well as how they were going to demonstrate the benefit from the investment.
Brilliant, thank you. Any other benefits or thoughts? Yep, Angela?
So I guess, Sue, you know this because I struggled with this exercise when we did it, because the funding that I sought was to fund a team / delivery of a program. So there's multiple things being delivered as a result of receiving funding. So it's been quite hard to go through this process and work out an evaluation, etc. We're coming to do this exercise again now. So in my mind, I'm thinking, how do I use this logic model for the delivery of the overall program, and actually how do we get to a point where we use this to help strengthen an evaluation at the end of it, given that there's multiple programs, some of which are incorporated through separate funding pots here as well. So it's just trying to, when it's not for something quite specific, it is a little bit tricky to order your thoughts.
Yeah, definitely. Sue, do you want to respond?
Yeah, I think that you're one of the perhaps more complex real programs. Historically, our funded work has been called programs, but my understanding of the terminology is that most of them are projects that have a particular goal that they're working towards. It might be multiple work streams within it, but the projects. Yours is very much a program, and there's a couple of others that we have as well, where you've got entirely separate pieces of work that might have completely different aims. And though I think that makes it a little bit more complex where that's the case. And it's up to you how you want to deal with it, Angela. Potentially you could have a different logic model per key piece of work. So you might have 3 or 4 logic models for your key pieces of work. Happy that you combine it and do one, and in some ways it makes it simpler for us, but it's about whatever makes sense from your perspective, really. I guess in the last bid that that was submitted from the primary care workforce team, it was a little bit more focused around specific pieces of work. So I would definitely sting back to that and pick those things out and focus on those, rather than trying to do it from a broader sense, because the complexity with that and the multiple funding streams, I think, makes it really messy. So I think this time round it'd be really useful to, even if you just focus on some of the key really big ones, that would be fine from my perspective.
Thank you.
Yeah, I think I would agree with that, and just add that use it to the extent that it is useful. So if it is in component parts or the different work streams and programs, or if it is an overall one, try and take it at different views as well. I think it was Rachel and then Elaine.
Oh, thank you. No, it was pretty much just along the points of Angela as well. Sort of, I'm tracking stuff at the moment through various different software platforms anyway, and it was just, I was wondering how I can build this template in so that it sort of dovetails with the types of things that I'm reporting on elsewhere as well. Whether you've got any thoughts or experience of that.
So what is the software tracking and how would you see it linking through?
Well, so at the moment I'm using Asana and Trello to track. I think I've got about 30 different projects at the moment I'm looking after. So it's just how you might see some of this dovetailing into that. That was why I was trying to marry up before, where you see each of those stages going in terms of, is it requirements, is it sort of your headlines where you see those dovetailing in, so that I could link those up effectively.
So I think I would take it a step back and say, what are you trying to answer, or what are you trying to report on? Because if you're trying to report on everything all at once and have everything feed in, then it will be quite large and possibly unmanageable to dovetail it. But if you say, I want to look at one particular work stream and I want to see through what I've done in terms of my inputs, the activities I've undertaken, what I've produced, and the results of that, then it could probably link quite well to the way that you're monitoring already.
It's easy to link all those things up. It's just understanding exactly where the fields that I report on elsewhere link into the fields that we're reporting on. That makes sense. So it's really easy to link them up within the software itself. It's just trying to avoid any duplicity, make it as efficient as it can be.
Yeah, so Sue, I would pass this back to you as well, if okay. But just to say that, yeah, the logic model is to help you with planning your evaluation. And so however you are going about that, pulling in what information you already collect or are using to that would be very beneficial.
I would agree. I think that you have to just be a bit careful with logic models, that they don't become overcomplicated. And you don't, when I said to do multiple ones to Angela, that's because she's running a multi-million program with very large pieces of work working across Greater Manchester with multiple funding sources. That's much more complex. Often when you've got maybe even a large project or a small program, you may be that you can just do one overarching one and actually try not to overcomplicate it too much. The whole point of them is to try and take a bird's eye view, stand back from it and say, what is it that we're really trying to do and how we're going to demonstrate we're going to do it. That's ultimately what it's about. So it just don't get too lost in the detail. What it might be worth doing, Rachel, is going away and having a look at it and reflect on it a little more. And then maybe when the drop-in session happens, or we can do a one-to-one if you prefer, we can have a look at your specific situation and see if we can help resolve any outstanding queries once you've had a little go. Because the reality is that often when you start, you go, no, it's too complicated, I could do it like this, or that is too simplistic, we need to split it apart because they're so different. And I think once you've done that process, we'll have a better idea, and I'm happy to help try and unpick it with you.
No, that'd be super. It's like, because I'm used to managing like multi-million-pound projects within corporate, so it's just making sure that I meet your requirements in the best possible way. So that'd be great. Thank you so much.
Great. Elaine?
Hi, thank you. I think I'm the opposite end. Sorry, so mine feels not too complex, but a bit too simplistic, and I'm struggling. I've kind of been mapping it out as you've been saying, so because ours is around writing a business case, and we've actually commissioned that out to a CSU to do. So I'm thinking it almost feels like it's pretty straightforward and very easy to do that. I think if we were looking at the project that we're trying to write a business case for, I can totally see the benefit of doing this and where this would go. But in terms of just that very small piece of work, it feels very simplistic. Is that okay?
Yeah, it really is okay. Yeah.
Cool.
I think the point, as I said before, is to make it fit for purpose. So you can have what is a very simple template, and if it is immediately answering and done, you know, don't think too hard about it. And if it requires a bit more input or a little bit more detail, then use it to the extent that it is useful. But don't think that it can capture everything, or that it needs to be more complicated than it is. So yeah, no, I think that that's perfect. Great, thank you. So then I'm just going to remind you about the template that you have and to use it. And I think that it's been very useful to hear about the different ways that you might be trying to do this. And just to flag again, the support from Sue and colleagues of the drop-ins, and that they are available to kind of go through some of these nitty-gritty practical things. I think one thing I found really useful in using logic models has been the process of talking it through with someone. So just saying out loud, trying to explain to someone else what you've got down, that sort of debate and discussion. Maybe because I'm a qualitative researcher and I think that this is how everybody should approach things in the world, but also just that the articulation of your ideas of what you're trying to do, what you expect to see as the change, and what would the result of that be. It's a really useful template for that. So just some reflections. There are different ways you can go about incorporating logic models in terms of timing and detail. So I think this actually relates a lot to the discussion we were just having. You could do a logic model when you start, but you can also do it retrospectively. And some of the pros of this, in either case, prospectively or retrospectively, is that prospectively it can help give you an opportunity to influence how your program or your intervention is designed and how you might approach collecting data for it. However, the cons of this are that there are lots of unknowns, so there's a lot to be figured out, and you know, particularly when you've already got you've got a program that's been received funding, you probably have this quite well articulated, and so you're sort of ready to go with it. If you do it retrospectively, it can give you a really clear and directive focus on what's important. Where do we need to show the change? Where do we need to show our results? And it can help you think back, you know, what made the biggest change, or what were the factors that led to it. However, sometimes you can't actually influence what the intervention is or the data that you have available. So there could be a missed opportunity in this, or it's just something to acknowledge. In terms of detail, if you take a high level approach, that makes it much more accessible, easier for everybody to understand. However, a con is that it could be slightly impractical in not giving enough detail for those who are delivering this program or evaluating it. If you go for granular detail, it helps bring to light, with a level of detailed scrutiny, those elements of the intervention and its design or evaluation. So it kind of helps you really think through visibly and clearly. However, it's not very engaging to look at. It's kind of quite time consuming to work through, and it can be quite difficult for people to understand what's going on or how to engage with it. The detail can also be in kind of providing some alternatives. So you could think about the ways that it helps shape design or evaluation and helps to explain to others what outcomes have been achieved or not, as the case may be. Some of the cons of this is that it can be time consuming. And so what I would say to this is, please utilize the opportunities that are being offered to you to work through it. Don't try and plow too much time or effort, and don't miss out on the opportunity offered by Sue and colleagues for these drop-ins, for these kind of checking points. The logic model does require a lot of information in some cases, and so it is an entire piece of work. It's not just something that kind of is routine to what you're doing in delivering the program. It is an expectation that you're going to be using it, but to kind of apportion your time and use it appropriately within that. So I'd like to thank you all for your time today and your attention and your participation. It was really great to hear about what you're working on, hear the queries that you had, and to learn with you. There are some further resources that are available, so particularly on evaluation and from the GM Workforce Collaborative, as well as courses available at ARC North Thames and ARC Greater Manchester. So thank you very much, and I'm happy to stay on the call for as long as you need to answer any other queries that you have. Thanks so much. Let me stop sharing.
Thanks so much, Silvie. That's been really, really good.